What is cigarette? Cigarettes are small cylindrical rolls of finely cut tobacco leaves wrapped in thin paper, typically with a filter at one end. They're designed to be smoked by lighting one end and inhaling the smoke through the other end. Cigarettes contain nicotine, which is a highly addictive stimulant drug, along with various other chemicals that are harmful to health, such as tar and carbon monoxide. Smoking cigarettes is a major risk factor for a variety of health problems, including lung cancer, heart disease, and respiratory issues. As a nutritionist, I strongly advise against smoking and encourage individuals to quit smoking for the sake of their overall health and well-being. How cigarettes affect our society? Cigarettes have a significant impact on society, both in terms of public health and economic implications. Here are some key ways in which cigarettes affect society. Healthcare costs. Smoking-related illnesses impose a substantial burden on healthcare systems worldwide. Treating diseases such as lung cancer, heart disease, chronic obstructive pulmonary disease, COPD, and other smoking-related conditions requires extensive medical resources and incurs high healthcare costs. Loss of productivity. Smoking-related illnesses often result in lost productivity due to sick days, disability, and premature death. This loss of productivity affects not only individuals and their families, but also workplaces and economies at large. Environmental impact. Cigarette production, consumption, and disposal contribute to environmental pollution. Tobacco cultivation requires significant amounts of pesticides and water, leading to environmental degradation. Cigarette butts, which are non-biodegradable, litter streets, beaches, and waterways, posing a threat to wildlife and ecosystems. Secondhand smoke exposure. Non-smokers exposed to secondhand smoke are at risk of developing various health problems, including respiratory illnesses, heart disease, and cancer. Children exposed to secondhand smoke are particularly vulnerable, with potential long-term health consequences. Tobacco industry influence. The tobacco industry's marketing tactics, including advertising, sponsorships, and product placement, can influence societal norms and perceptions related to smoking. This influence can perpetuate smoking behavior and undermine efforts to reduce tobacco use. Social and economic disparities. Smoking rates tend to be higher among certain demographic groups, including those with lower socioeconomic status, marginalized communities, and individuals with mental health disorders. As a result, smoking exacerbates existing social and economic disparities. Government revenue and regulation. Governments rely on tobacco taxes as a source of revenue, but this must be balanced with the need for effective tobacco control policies. Regulations such as tobacco taxes, smoke-free laws, and advertising restrictions play a crucial role in reducing smoking prevalence and mitigating its societal impact. Overall, cigarettes have far-reaching consequences for society, affecting health, the environment, economic productivity, and social well-being. Efforts to address tobacco use require comprehensive strategies encompassing public health initiatives, policy interventions, and community engagement.